A termination for medical reasons is an abortion. It's an abortion that usually happens in the second and third trimester. It is a wanted pregnancy. It is usually a planned pregnancy. It is a pregnancy that would come to term if there wasn't a sickness involved. TFMRs usually happen in the second and third trimester. The reason for that is the sickness isn't detected until the anatomy scan or even other screening tests. So the non-invasive prenatal testing is done. It's a blood test. It's done from like 11 to 13 weeks. That picks up the chromosomal abnormalities like Down syndrome, trisomy 13, trisomy 18, and a few others. And then the nuchal translucency is also from 11 to 13 weeks, and that's an ultrasound, and that can pick up, again, chromosomal abnormalities. In the case of anatomical structure issues, so like you go in for your ultrasound from 18 to 22 weeks and you find out the heart, there's like multiple heart conditions, the brain isn't developing correctly. There's all kinds of either very obvious problems with certain structures, or there's indications that there's something wrong. So then oftentimes people get an amniocentesis, the DNA is sequenced, and they find out there's a genetic issue, there's a deletion, there's a mutation, there's a certain syndrome or disease. In the case where the fetus is sick, oftentimes there's two types. There's the fatal fetal diagnoses where death is imminent, either in utero or upon birth, or there's the gray diagnoses, and the most like visible gray diagnosis would be something like Down syndrome, right? There's a large spectrum. And then the second type is mom's health is at risk. So mom can have very severe mental health issues. Mom could find out she has cancer and she can't fully pursue treatment until there's a termination or until birth, and maybe she won't make it. There's all kinds of different things where mom needs to terminate for her own health.